Joining us now is the House Republican Whip, Virginia Congressman Eric Cantor. Congressman, thanks for your time this morning. The president said last night, my door is always open if you have a serious set of proposals. This morning, are Republicans considering walking up to that door?
Well, Jane, I think, first of all, what the American people are expecting is not necessarily that we get health reform done soon, but more importantly, we get it done right. And the most important thing is to, first of all, step up and demonstrate to the people that we're listening. And I don't know if the president all the way got there last night to communicate that, number one, we've got to guarantee that there will not be a substitution of a government in making decisions in health care for the patient and the doctor, because they are primary, not the government. Secondly, we've got to go and present to the people a plan which ensures there will be no forced government rationing, no discrimination on any basis whatsoever. And third, we've got to, in any plan we do, demonstrate that we're not going to break the bank. And currently, with the president saying his plan costs $900 billion, we know the way Congress is, it'll be over $1 trillion. We can't afford that. We've got to figure out how we're going to affect reform so that it actually is done right and works and we can afford it.
Then talk to me logistically, if you will, the morning after this speech. How do you make that happen?
Well, you know, the president did say that he is open to ideas. So there are many things that we can work together on. I mean, first of all, we should be working very hard to take care of the pre-existing condition situation. We also can address the portability situation. You shouldn't have to lose your health care if you lose your job. We've got answers and solutions to that. And thirdly, let's go about serious reform in terms of lawsuit abuse. We've got to get the lawyers out of the examining room, and that'll save us significant amounts of money so that we can do the reform right.
You know, that was one of the overtures that he made last night. He did talk about a possibility of looking at this mess of medical malpractice tort reform, as it's referred to. It's not in a bill as it stands. If it were actually in proposed legislation, would Republicans be on board?
Listen, we need to work very hard to try and get meaningful lawsuit abuse reform. I mean, the president last night discussed how we're going to have some type of projects to go on in and around the country, different states. The problem is, unless you affect state law in some way, shape, or form, change it at that level, or do something at the federal level, you are not going to have meaningful tort reform, and that's what we do need as a first step to reining in the costs associated with health care in this country.
Just a couple of minutes ago, Speaker Pelosi said we will pass reform this year. The question is, what will it look like? What do you see if you look into your crystal ball?
Well, I'm hoping that we can take care of the situation where you've got individuals in a market of individual insurance where they have a pre-existing condition. Let's say they are stricken with a disease like MS or Crohn's disease, and obviously have a much higher bill for insurance premiums. We ought to be able to address that. Senator McCain, when he was running against President Obama before the president was elected, Senator McCain offered up universal access programs at the state level. We ought to be able to make that happen now. The president says that we agree on so many things. Let's go ahead and make that happen. Let's also make sure that we've got the flexibility in the insurance laws so that you don't have to lose your insurance when you lose your job. These are things that we can make happen now and not try and go in and change what people like about their health care. Let's remember, most Americans have health care. Most Americans like what they have. We've got to address the cost. And that's the direction in which we should head.
Congressman, before I let you go, I do have to ask you about a photograph and some video that are making the rounds this morning of you on your BlackBerry. Your fingers are working pretty hard there during the president's speech last night on the floor. My co-anchor would tell you I'm probably the last person who should ask what anybody's doing on one of these machines, because I'm as addicted as anybody.
On yours.
What were you doing, though?
Listen, you know, let me tell you something. I mean, come on, that's really not the important thing. But as you know, we use BlackBerries to take notes. We use BlackBerries to communicate. But listen, the people are looking for us in Congress to go ahead and make some progress and meaningful reform that makes sense. That's what we're trying to do in the debate after this speech. That's, I think, what the president came to Congress to try and prompt us to do. And we just got to arrive at a point at which we're going to reject any notion that the government is going to replace the system of health care we've got in this country. That's where we should be focused.
I asked, Congressman, because the critics say you weren't paying attention and it was disrespectful, and they say that that kind of falls in line and where the Republicans are on this issue.
Well, you know, I reject that notion, obviously. I mean, I think that all of us were in the chamber listening to the president. Obviously, he is the president of our country. We need to work with him and make sure that we get this thing right. And obviously, I don't agree with all of what the president said last night, but that's the process here. He has invited Republicans in to offer up our ideas, and we intend to go in that direction and do just that.
Congressman Eric Cantor, and when I sign up for that Crackberry Addicts Anonymous, I'll give you a call. You may have the same problem I do. Thanks for your time, sir.